Yes, absolutely, Hugo. So good to be on your program this morning. So yes, believe it or not, in our sectors of health and social development, we are still in need of skills across all levels and occupations in the sector, from the high-level specialist skills to mid-levels and even the low-level skills. And at the moment, also particularly in the areas of managers, professionals, technicians, and associate professionals. Also, the sector that is in dire need of skills is also the veterinary services. And this sector has been under huge pressure due to prolonged skill shortage and also vacancies. And of course, you know how important this sector is in terms of reducing the risk of animal disease and the impact on our food security.
Maybe, Elain, what you could do for us is break it down for us to specific jobs in these sectors, maybe to give our viewers an idea of what it is that they'd be getting themselves into.
Well, thank you, Hugo. In terms of our sector, it is really huge, and there are hundreds, if not thousands, of different jobs across the sector of health and social development. So this is what the youth of our country are not really or having access to, is understanding what types of jobs that they are available for them. So there's anything from, of course, we know the usual ones, the doctors, the nurses, and so forth. But then there's also the childcare center worker and manager, cardiac technicians, biokineticists, biochemist, child and youth care workers, audiologists, from physiotherapy to psychology. Some of the other ones, pharmacy, optometry, dentistry. So there is a wide range of careers and occupations within health and social development.
Are we able to discuss numbers in terms of what's available? What gap are you looking to fill?
Well, in terms of the gap, there's various factors that affect the skill shortage in our sector. So some of those are, of course, our ever-changing socio-economic realities. You know, Hugo, we have a high burden of disease in our country. We have high level of interpersonal violence, vulnerability, destitution and social crimes, and all of these put pressure on the sectors of health and social development. So the sector is constantly changing. And in terms of the numbers, that is also changing. So I can't indicate the exact numbers, but in all of the fields, as I've said, there is skills shortage needs. And of course, there are some important things that have come up, like, for instance, the national health insurance, where we would need skills in primary health care and other occupations that will help support that. We also have COVID-19 and the devastation that has caused, and especially the pressure on the capacity in the health and social development sector. And then, of course, our constitutional imperatives. So our constitution also indicates that everyone has access to education, shelter, health, safety, and this also is a changing need, as well as, of course, the white paper for social welfare. So we constantly need those numbers. And if you also have a look at the ideal ratios of health professionals to people in our country, you'll actually see that there is still a dire need for these skills.
Now let's take a look at veterinary, the veterinary sector, which I'd like to think is probably not top of mind for a lot of young people. What sort of advocacy work will you be doing now that the portal is up to drive traffic, so to speak, to the portal?
Thank you for that, Hugo. Especially we are trying to drive youth into the veterinary sector. As I've indicated, there is also a shortage there. What we have done is we're on various social media platforms. We're on Facebook, Instagram, Twitter, And of course, we have just launched this exciting careers portal. So from our other social media platforms, we are driving people through to the portal. If you go onto the portal, it is so easy to use. You need to register on the portal, but it'll prompt you. And then it'll actually take you through what careers are best suited to you. For example, just for me to have a look at our offering, I actually went on there and I also answered the easy questions. I went through that, and there was a host of careers available. So it also doesn't really matter, Hugo, what you have as your subjects in matric, because there are a number of careers that you will have access to. Definitely, if you go onto the portal, it'll help you with veterinary science, where you can study it, what type of subjects, but it is not only veterinary surgeons in that sector, we've also got technicians, nurses, and so forth.
I suppose barriers to entry is probably a factor that you would be dealing with. How have you engaged with the young people around some of these issues?
Well, barriers to oh, sorry, Hugo, I just muted myself for a second. There are barriers to entry depending on what you'd like to study. But don't think just because you hear the sector of health that you do need maths and science. There are so many other occupations that you can enter into. So that's why we urge the youth to go onto the portal, and the portal will guide you. So don't let maths and science be a barrier for you to enter into the field that you have a passion for.
Well, Elain, it's been lovely speaking to you this morning. Thank you so much, and congratulations on the launch of your portal.